Thank you to those who have joined us. We're going to get started in just about another minute. We're just giving a few more people some time to join in.
Hello.
Hey, Lily.
Okay, it worked. Sorry, guys. I don't know what happened.
It's okay. We're just glad that you're able to get your audio fixed.
Yeah. Gosh.
I guess we can just get started now. And if anyone joins in during our session, they can ask any questions if they miss any part of the conversation. Thank you to those of you who joined us today. For this session, we are going to review NHSN, the vaccination reporting. If you have anything specific that I have not covered in NHS regarding the vaccination reporting, feel free to, and you can either unmute yourself or chat that in when we get to the questions opportunities, so we can have conversations about that. I'm just gonna go through a few updates before we begin. Some recent updates that came out through CDC. It was a little over a week ago now. I just want to go over those with you in case you haven't heard about these updates. The first one is has to do with reporting the medical contraindication, which is question 3.3. And this is for both residents and staff. And if you have any residents or staff who had received the COVID-19 vaccine dose 1, and then they had some type of allergic reaction such as anaphylaxis, or they had, let's see here, there was also myocarditis, pericarditis, that is considered medical contraindication. And so in the past, users were originally instructed to count them in dose 1 and leave them there. So they were always showing as dose 1. And what they've now determined is that should be considered medical contraindication. And if they had a reaction to a vaccine dose, and they should be moved to be added to the counted for the medical contraindication and removed from the dose 1. So it's no longer counting against your facility's rate. And so that's the first clear update. The second one is a defect. There was a defect in the NHSN application that was identified where long-term care facilities were originally unable to save custom analytic COVID-19 vaccine data reports. So if you were one of the facilities that were trying to save a report, download it. So whenever you go log in and you try to pull the specific type of report that you created with only certain components that you wanted, you made it customized for yourself and it wasn't saving. It's now, that defect's been removed. So now you should be able to save it. So moving forward, when you go back into NHSN, pull a report for your facility and you have it customized, it should keep that customization for you. CDC has updated the COVID-19 vaccination data reporting guidance to include vendors under the other contract personnel. There's a wide list of these other contract personnel professions that are listed in the FAQ webpage in questions 14 and 15. So if you'd like to get that clarification as far as who all those healthcare professional titles are to know who to count under that section, then you can look there. And I believe it's posted in chat directly to the FAQ page. Also, question 4, well, the original question 4 that was there that was asking about individuals eligible for an additional dose or booster, that has been removed. So you will not see that question. Instead, you'll see what was originally in question 5, which is the total number of residents or total number of healthcare personnel who have received the booster. And so that was originally question 5. It's now question 4. And so and that's what's effective last week, I believe. So if you're reporting, then you'll notice that question was missing, and that was intentional. Updated guidance that is no longer necessary to delay COVID-19 vaccination following receipt of monoclonal antibodies. So originally we were told that there should be a 90-day time frame to wait to give someone a COVID-19 vaccine once they've received monoclonal antibodies, and it's no longer needed anymore. So you no longer need to wait that 90-day time frame. The interim clinical considerations for use of COVID-19 vaccines does not indicate a time frame of when to give an individual vaccine after active COVID. So that was another question. Some facilities have their own internal practice, or maybe they've seen it somewhere in writing where it had a time frame like wait 10 days, wait 14 days, something like that. Well, the CDC language does not have a specific time frame. They just define that it's appropriate to give an individual the COVID-19 vaccine when they've recovered from the symptoms, if they had symptoms. So once they make a full recovery of those symptoms, then you can give them the vaccine. And also, if you haven't done so already, a friendly reminder to complete the annual survey. If you have not done so already, like I said, if you've already completed, great. If you have not, you'll see this. It's under your action items section. So you can find it under the alerts here. You go to alerts and then it will show up, or you can go to your dashboard and you'll see it also show up under the action items. So that is something that has to be completed every year. It's a one-time thing. It's basically asking for, some of the questions are pertaining to surveillance, like census data from the prior year. Some of the questions are basically the same as what was the prior year, just basic information about your facility. So some of the information may not change. I would encourage you though to print out a copy of the survey. There will be an option to do that. That way you make sure you complete it all in one sitting, because if you try to save it in the middle, it will not save. You have to complete it all in one sitting. So make sure you have all the information you need when you're going to go in and complete it. And so some reporting tips, how to determine, I hear this from facilities, how to determine which healthcare personnel to include in reporting. And the reason could be, there's either your employees who are your payroll employees, and then there's your healthcare personnel who are non-employees. And so how do you know who to count? And so one thing I can say for employees who are on the payroll, so those employees should always, as long as they're active employees, you're going to continue to count them every single week. And if they're on vacation for 2 weeks or less, you will continue to count them in those weeks that they are not reporting during their vacation. But if it exceeds more than 2 weeks, so if they're going to take a leave of absence or a vacation is going to be 3 weeks, that very first day that they have not worked at least, have not worked at least 1 day, regardless of hours, then you stop counting them until they come back. But again, this is if they're going to be gone for longer than 2 weeks. For the healthcare personnel side, so it's non-employees, for the non-employee side, then those ones you're going, so sometimes you might get people who come in to the facility, like therapists might come in once a week or once every few weeks. You're going to count them only the weeks that they worked. So if they didn't work a few weeks, you're not going to count them. That's really the best way I can explain on how to count the healthcare employees. And so if you have like someone who comes in, for example, a medical director comes in once a month, my understanding is you will not count that medical director except for that week they come in that one time. You count them, of course, and then you stop counting them until they come back again. Question 2, cumulative number of residents, and this is or healthcare personnel in question 1 who have received COVID-19 vaccines at this facility or elsewhere. This is the question where you break down their vaccine status. So if they've had at least 1 dose or if they completed their dose, you want to make sure that you count everybody that's had a vaccine. This has to reflect, of course, what you put in question 1, which is the total residents you have in your building for that week, and the total staff as well. So this is everybody. And so it's cumulative numbers, and you want to make sure you select all the vaccines that apply. So if only Moderna was the only vaccine that everybody in your building, all your residents and your staff had, you're only going to select Moderna. But if there's Pfizer, Moderna, Johnson & Johnson, you want to select all those options and break it down to the total of who have had dose 1 and those who have completed their dose. Make sure you count those correctly. I have seen some issues though during that I want to bring up to make sure that hopefully you can look out for these to prevent these issues from happening. So one example is I've seen entries for counts in the completed dose 1 versus 1 and 2. So if somebody meant to put for Pfizer vaccine, for example, they're putting in, I've had 1 resident who's only had dose 1, but I've had 18 residents who have completed the dose, but you reverse it and accidentally put in dose 1, there's 18 residents and 1 for completed. I've seen that happen, and that can, for one, affect your vaccine rate. It will drop it. That's one issue. So always make sure you go back and double check that you're putting in the numbers in the correct fields. Also, I've seen it where they meant to put, let's say 83, but they accidentally put in 3. They didn't realize they were going through it so fast. They didn't realize they didn't put the 8 in there. So that would, of course, drop your rate. It would look like there's a lot less people. And then when you try to save your data, you'll also probably get a note saying that it's not adding up. The totals aren't adding up because you're not breaking down all your total count that you put in question 1 and questions 2 and 3. And not all residents or healthcare personnel are included in the breakdown of vaccine status. So that was what I was saying for making sure that you're selecting all the appropriate vaccines in question 2. You're selecting the Pfizer, Moderna, if all those apply, and Johnson & Johnson. You're going to select them all if they all apply, at least with one person. So don't miss any of those if any of them apply, because that will also affect your rate and your count. It won't add up. And also, I haven't seen this as common, but I still see it every once in a while with facilities, and I want to bring up about unspecified manufacturer. When you're in the drop-down selecting the type of vaccine, there is an option for unspecified manufacturer. And that's not, CDC mentioned before that they really don't want facilities to just select that as a default because it's easy. You don't have to worry about, breaking down the counts, because they want to know the actual type of vaccines people are getting and how many people in that facility have gotten this specific type of vaccine. So unspecified manufacturer is not the ideal. However, there are certain situations that do apply where you will need to select unspecified manufacturer. For example, if you have a surveyor that comes into the building, you're going to, because you aren't supposed to ask them, I guess, or not supposed to, but I guess from what it says in CDC language is you don't ask the surveyors for their vaccine status. So you're just automatically going to put them under as unspecified manufacturer for that week that they're in the building. And also residents who received complete COVID-19 2-dose vaccination series and had documentation of different manufacturers for each dose received. So they may have gotten dose 1 Pfizer, dose 2 Moderna. So that would be, because you can't select one or the other, you put unspecified manufacturer. Residents who received complete COVID-19 vaccine by a vaccine manufacturer not listed in question 2, but listed for emergency use by the World Health Organization, and they have documentation of the completed vaccination to prove it. Or the other option would be residents who received complete COVID-19 vaccine through a clinical trial. So they were part of a clinical trial, they completed it, and they're able to prove they completed it. Then you can also count them as completed, but you have to put them under the unspecified manufacturer. Another thing for unspecified manufacturer, if somebody tells you, whether it's a resident or a healthcare personnel, oh, I completed it, but I don't have proof, I lost my vaccination card. Well, there's every state has their own IIS system, which is the Immunization Information System. And since you're a facility, you're considered a provider for your residents, you can go in there as a provider and you can look up your residents' their vaccination status. Like, you will not only get the COVID, it will show all their vaccine records. So you can get that information, you can print it and save it for your records, and then you'll know if they've received the COVID-19 primary series or the booster as well. And your staff, because you're not their provider, they have to go in themselves and print it, but that is an option though. So if they don't have their vaccine card to prove it, say, well, show them, direct them to this website, and they will follow the steps. They'll pull up their own vaccine record, they can print it out and turn it into you. In question 3 is cumulative number of residents and healthcare personnel in question 1 with other conditions. So between questions 2 to 3, whatever the amount of the total residents and total staff that you're counting, those have to add up to what you put in question 1. So this is the other part. So those that haven't received a vaccine, there's 3 options to indicate why they haven't received it. So the first one is the medical contraindication. I think I said earlier 3.3, but I meant to say 3.1. Medical contraindication or exclusion to COVID-19 vaccine. So this is if they have a known diagnosed allergy to a component of the COVID-19 vaccine, or for the Johnson & Johnson COVID-19 vaccine following receipt of a previous Johnson & Johnson COVID-19 vaccine. So they received it, they had allergic reaction. That could be, again, a medical contraindication, or what I mentioned earlier, if they have a history of anaphylaxis, or their heart was affected, and they had inflammation of the heart. And so any of those reasons could be considered medical contraindication. So you put them there. And the second option will be 3.2, which is offered but declined COVID-19 vaccine. The two acceptable reasons that would go in there are residents and healthcare personnel who decline the vaccine, they just flat out decline it, or if they have a religious exemption. So they could still work it for your facility because your facility accepts the religious exemption. However, they still are considered declined. So you still report them there. And the third option is unknown COVID-19 vaccination status. This is not as common because of the IIS system that I mentioned earlier. You can always go in and find their information. If it's resident or the healthcare personnel can get it for you that way. Any questions so far? I haven't checked chat yet, but are there any questions, or anybody want to unmute themselves and ask a question based on the first two questions I reviewed? Need clarification?
Hi, it's Mary Jo. I just have a question. So if a doctor doesn't, or anyone doesn't show up that week, we're doing the vaccines in the computer, we don't count them?
If
like if a doctor's
go ahead.
If a doctor's not in the building, they only come in say twice a month. So I don't count them on the weeks that they're not here.
Are they a regular employee? Or no, wait, they're contracted, right?
Right.
So you would count them the weeks that they're there. You don't count them like the weeks they're not there. You count them the weeks that they are there.
Okay. All right. Thank you.
Yeah, you're welcome. Any other questions? Okay, and if you think of a question about those two questions I just reviewed for questions 2 and 3, we're gonna go over questions again later, so we can talk about that then. So question 4. So as I mentioned, the prior question that was in question 4 that was asking about eligible residents, total eligible residents, and total eligible staff is now gone. So question 4 is now asking for the cumulative number of residents in question. Sorry, I should have said question 4 should not be showing there. Cumulative number of residents who have received an additional dose or booster of COVID-19 vaccine at this facility or elsewhere. So this is asking, like I said, how many, and this is cumulative, it's not only new. So I have seen situations where facilities have reported only new cases. So whenever, not cases, new doses. So when residents and staff get new doses for that week, they will only count those. So their numbers will fluctuate. It will show some weeks will be 13 and some will be 2 and some will be 1. So that's kind of an indication that they're only adding in new doses. So make sure that you're adding cumulative. So this is everybody, all the residents in your building who were spent at least 24 hours in your building for that week, whatever their vaccine status is. So if they had received a booster, you're going to count them. Same thing for staff too. You're going to count them, all of them in the building, not just new. And this is a little table that shows recommendations for additional doses or boosters for each vaccine. Sometimes when you're saving your data, after you've done reporting your vaccination data, you might see a soft alert notification pop up when saving. And so some facilities have asked me, what does this mean? And so there's 2 indications. So one is it will compare prior week's data. You'll see something about, oh, this week's data is less than or greater than last week's data. Usually it's saying less than because it's noticing a drop suddenly. And it's an automated system that just is there to help users to prevent them from reporting errors. It's just one way. And so it doesn't mean that you can't save the data. You can still save your data, but it's just letting you know, hey, there's a difference between last week's data and this week's data. There's a drop. It will say like 50% higher or less than in the previous week, something like that. So it's just let you know if you see that, just double check your data, make sure that you're not reporting any errors this week or even last week. Double check both of them, especially if you know that if your census doesn't change very much and you see something like this, that's a good indication that something was probably reported incorrectly in either the week that you're reporting for or the prior week. And so that I would highly recommend checking that. I would check even if you do have a census that changes weekly. If it's about the same, even though it changes if you have like a high turnover and it's kind of maybe around the same still, definitely check that too. But like I said, it's a good double check system. Also, another indication will show an error notice due to data reported. So that would be if you are trying to save your data and the data is not totaling up properly between questions 2 and 3 to add up to what you put in question 1. So if you have 80 employees, you put in for eligible in question 1, and you're not breaking all 80 employees down, or maybe you're counting over. I've seen it where they've counted over by accident. It's totaling up to more than 80. Then that will be obviously meaning that too many people were counted in a specific field. So that's where you want to double check and add up everybody, making sure it's totaling properly. And NHSN reporting tips for user access. This is based on the amount of users in the building. So we highly recommend at least 2 people in a building to have access to report NHSN. One's a main user, one's a backup user. And the reason why is because if the main user, let's say they're sick suddenly, or they're unable to work and it was unplanned, suddenly the facility is without somebody reporting and the facility can get cited. So the backup user can come in handy with that, where long as they have access and they know how to report data, they know how to get the data that they need to be able to report it, they know where it's located, then they will be there to continue with reporting so the facility doesn't get cited. So it's always good to have at least 2 people. So there is a link that was posted in chat on how to add a user. So if your facility only has 1 user, we encourage you to look for somebody else who could be a backup user. It doesn't have to be a clinician. It could be an administrative person. We've seen some facilities have someone from medical records or administrative assistant or HR business person be a backup user. So it could be really anybody, as long as they know how to get the data they need, so that way they can report. And in regards to adding users, if you 2 situations that can apply. So if there's somebody in the building with access to to add users, then the add users link that was posted will apply. But there's sometimes when somebody is new to a facility and they're going to be the main user, but there's nobody else in the building. Let's say the main user left, and they didn't have a backup user. There is another way that you can get access. And so you're going to fill out the role reassignment form. And that is also in the chat here. I see reassigning the NHSN facility administrator. So basically you go in there and you fill out who the old administrator was, and you're going to put in their name, their email address, and then you're going to put your information or whoever the new person's going to be. And then NHSN will get back within about 48 hours with business days, 2 business days, and send an email confirming that the change has been made. Any questions so far about that? Users, or question 4 about eligible entering in total accounts? Billy, do you see any questions? I'm checking chat right now. I don't see anything. Okay.
I don't see anything, no.
All right. Great, thank you. All right, so updates. So I don't know, does anybody have any issues with tracking right now where it's taking them a lot of time to track their data before entering it in? You can go ahead and put in chat if you have a system in place that you think works for you, or if you would like additional information on ways to improve your process, we can also help with that too. But I did want to talk about these data tracking worksheets I love, and I'm always promoting them any chance I get to facilities, especially if a facility is finding themselves taking like 30 minutes or more to gather the data they need in order to be able to report it, especially if you're reporting once a week. You're like, okay, it's taking me over 30 minutes to do this just to collect the data. Now I have to report it. This can be a good time saver. So there's a data tracking sheet for residents, and there's also one for healthcare personnel. And what you do is you go in there, you put in certain specific information about, like, for example, residents. You put their admission date, their vaccine status information, like basically the questions align with what's in NHSN. And then there's another tab in there that will auto-calculate it all for you based on the criteria you put in that other tab. And then so you go to that final tab when you're ready to report, as long as it's up to date, the data is all current. And then you just put in the numbers that it tells you to put in. And so it's just and you don't have to, you basically only make updates whenever there are updates needed. So if you have new residents come in or new staff who come in, you add them into it, or when residents leave and when staff leave, you put the end date in there, and then it will stop counting them. Or if their vaccine status changes, you update that too accordingly. And so the system, the other tab, will auto-calculate that all for you. So I love that feature. And so if you are looking for ways to save some time and this sounds like something might work for you, please let us know, and we'll be happy to send you more information on this. But it's actually, you can get it from the webpage as well. So when you go on the main webpage, there's a data tracking worksheet section, and then they are both saved there. You just download it. And the date should say January 2022 date in there. And that's how you know it's current. It looks like this basically. There's a first, so you put in the reporting they're reporting for, and you put in all your criteria. So resident admission dates, the staff one kind of looks similar as well. And when they leave, you put the discharge date and it will stop counting them in the formula, the other tab there. But if you don't have anything, it'll continue to count them. So you just fill out the criteria, especially everything with the red asterisk is required. So you make sure you fill out all that stuff. I'll be happy to, if you need have some questions about this, if you're trying to get the hang of this or get set up for this, you're welcome to reach out to me and I can help you guide you on how to complete this. But are there any questions so far? Do you come here with a specific intention of getting information on something that I haven't yet addressed that you would like to mention? You can chat, or you can unmute yourself, or if you called in, press *6 to unmute yourself. Or did I cover everything that you guys came for NHSN reporting? For those of you who joined the nursing homes, have you, going back to the tracking the process, does this sound like something you might be interested in? If you maybe aren't happy with your current tracking process and you want improvement, do you think that this tool might be helpful for you? Would you like more information on it?
Yeah, this is Mary Jo. I would like that tool where I can find it.
Yeah, definitely. I can send you a link. Ashley, if you can put in notes for me to follow up with Mary Jo about this.
That would be great. Thank you.
Yeah, you're welcome. Mary Jo, were there any other questions you had that you came for this webinar wanting to get information on that we haven't covered yet for NHSN?
No, it's just an ever-ending process.
Yes, it is.
It's just, I got the hang of it, but you know, it's counting everybody, and I didn't know about not counting the doctors or the contractors that don't show up. You know, only come in a couple of times a month or once a month. So okay. That's going to be constantly taking them in and out.
Yeah, well, and also, and if you've done it in the past, I don't think it's going to make a huge difference, right? I don't think it's affecting your numbers drastically, right? It's just a few, right? Would you say? Because I don't think it's enough to where you have to go back and make all the corrections in the past if it's just some doctors that you were counting.
No, I'll just have to follow up with of who's here and who's not. You know, I think some doctors only come once a month, so I'll just have to talk to medical records because she sees them the most to see if we can keep a tally of who shows up.
Okay, yeah, sounds good. Anybody else? Carolyn, did you have any specific questions that you wanted to get addressed that haven't been addressed yet? Or Violet? Or did I address them? You can put in chat too. Okay, thank you, Carolyn. All right, so how can Comagine Health staff help to improve vaccination data rates for you? So if you are struggling to improve your vaccination data rates because you're having issues with staff or residents getting their vaccines or their boosters, we have been working with facilities. We have dedicated staff members who've been working with facilities who have knowledge of resources and tools that have been proven to help facilities and can be useful with maybe sometimes it's just a matter of changing your strategy and your approach to these people who are reluctant or hesitant to get the vaccine. And we go based on experience from what we've heard from facilities that have been successful practices, and also tools that we're aware of that we've looked into that we thought were helpful as well. And so we'll be happy to help with that. So we can help with providing that information. We can help with making phone calls, distribute paperwork if you would like to become an enrolled provider to distribute vaccines. So that way you guys can store the vaccines at your location and in a refrigerator and monitor the temperatures. You're able to meet those guidelines, and in becoming an enrolled provider, you can do that if that's something that you're not currently doing, and work closely through the process. And we can help you guys with the process until the first clinic, or the next clinic if you've already had one clinic. But if you're having access issues to getting access to vaccines because of your resources, their availability. They're like, well, we're not available for another 3 weeks. That can obviously affect the vaccine. So we have resources and ways to help you guys find resources to help get you guys that access. So you have vaccine clinics a lot sooner. And like I said, if facilities, pharmacies, partners are not supportive, we can help find other partners too. And we do have weekly half-hour events. So events like this is every Tuesday. We also have one, it's an open office hour session every Friday. So the ones on Tuesdays, like today you attended, are more of educational. We talk to you about and give you guys resources, things like that, and where it's more of a listen mode. And then the open office hours are more interactive, to where other facilities, it's more of discussions with facilities. So Comagine Health Staff and facilities, we also have guest speakers sometimes come in, and they'll talk about their best practices, what worked for them to increase their vaccine rates. And so, and they're from different settings. We try to focus on getting some that are struggling with short stays, some COVID dedicated units. We're trying to reach out to basically everybody who has different settings. We know it's not just one type of setting. So if you are interested, if you haven't already attended this, we encourage you to attend at least one if you can. Multiple ones would be great. If you're, like I said, we try to keep it different. So they're all different. They're not the same. And so they can be very helpful for you. And if you can take a moment to complete a quick evaluation poll just to help us determine if we met your needs today, or if we need to make some improvements on sessions like this. Maybe we didn't meet your needs. You're welcome to put your input in there. So just let us know. And while you're doing that, I'm going to go to the next page. And I wanted to provide you with your contact information for your state lead. Actually, I want to update the Washington one. I just realized we have a new state lead. So Donna Thorson was the intern for Washington. We actually have Shannon Finnegan. And so, sorry, Shannon, I didn't update you on this. I just realized this is an old slide. So I will update that next time. But Shannon Finnegan is for your Washington. Actually, Shannon, can you do me a favor and put in your email address and your name in here for the Washington people? So if anyone's from Washington, they can get your updated information. Thank you. All right, so we have, let's see what time it is. We are 2 minutes past, so I don't want to keep you any longer. So thank you all for joining us. Really appreciate it. Let me know if you have any other questions outside of this session today. If anything comes up with NHSN that you're having any problems with, you're welcome to reach out to me. My email is here. It's lbarton@comagine.org. Thank you.